So inhibit, okay, the next one is going to be lengthen, okay, activate and integrate. So lengthen is just another word for stretching. Yes, you guys are still with me after 4 hours of Randy. Love it. Okay, so lengthen a muscle with static stretching or neuromuscular stretching. Another technique you guys probably should learn is called Pnf stretching. And it's really, really good because it helps fake out the Golgi tendon and stuff like that. And I can talk a little more offline, but it really helps reducing stiffness, range of motion, increase, and of course your posture. Activate, okay, this is a cool one because what happens is when the muscles are overactive and then the ones that are underactive, so we want the overactive ones to what? Relax, calm down, kind of, do their thing of what they're supposed to do in their, without too much spasm. And then the underactive ones, of course, we want to make them active as well. So again, the idea is to balance both sides of a joint, okay? So if a joint is going one way, it's because either it's underactive or it's active. It's going to pull it on either sides of the joint. So we always want to balance the joint, okay? So strengthening techniques, so you have activating muscles, improving muscle endurance and strength. Sorry about this one. I don't know why I cut it off, but basically, then we integrate, okay? So that's actually creating new dynamic exercises that you bring into their program. And the cool thing about NASM is they give us like exercises and foam rolling and all this stuff. They give us templates of what to do for a forward head or for rolled shoulders or for a knee that's valgus and stuff like that. So I'm going to show you guys. They give you a template, which is really cool. So it's kind of a no-brainer. You kind of put that in with your NST stuff, and you've got a corrective exercise kind of plan. Yes, you got to use a little bit more of your kind of knowledge, skills, and ability to add to it, But you'll see it here in a second. But it's really, really good how they did that. Okay, so overhead squat views. Okay, so we're going to do 3 views: anterior, lateral, and posterior. I believe we call this one coronal. Okay, so second, I say the second or first toe to the middle of the patella, right up to the ASIS. So when we do our little assessment today, we're going to line people up. We're not going to worry about a template because you'll probably already have one. ASIS over the first and second toe. That's how we're going to line it up with the NASM as well. Okay, and then this is what I was talking about too. So you have 2 lines here, and I brought some sticks in to show you. Basically, tibia, torso, not torsion. So tibia, so they're supposed to remain in that range. In that actual parallel. Thank you. Yeah, exactly, in that parallel. And then, of course, from the posterior view, feet are flat. You're going to run straight up, right the middle of the spine, actually, all the way to the head. And then, of course, the PSIS is supposed to be even as well. That's how we measure this when we're looking, and I'll show you what we're looking for. An idea, this is the most common. So when you're looking at the feet, all you're really going to look at is, you're looking at 5 kinetic checkpoints. You're looking at the foot and ankle, okay? And you're looking at the knees, the lumbopelvic hip complex, the shoulder, and then the actual neck, okay? So the first one is the overhead squat, anterior view of the feet, okay? They're either going to flatten, they're going to turn out, the knees are going to valgus, or the knees are going to varus, okay? That's what you're looking for when you're looking at the anterior view of the feet and the knees, okay? The next one, when they are in the coronal view, there's the lower back arch. There's the lower back round, excessive forward lean, and the arms falling forward. And there's the lines, okay? Again, crossing. So in the book, it'll tell you what exercises to inhibit, what exercises to do to strengthen and lengthen and stuff like that. From the posterior view, okay, feet flatten, okay, heels rise off the floor, and asymmetrical weight shift. You guys know what asymmetrical weight shift is? When you squat down, it shifts over, okay? A lot of times what happens is, and I'll show you in the next one, you maybe have a stronger or weaker piriformis on the opposite side. So,
longer leg.
Say again?
Longer leg.
Could be a longer leg, absolutely, Tony. Yep, exactly. So those are what we look for when we are looking from the back, okay? And here's an idea, here's an example. I like this because it kind of gives you the muscle. So on the left side, you can see her line here where she's running up the middle, okay? Overactive muscles, of course we know piriformis, bicep fem. Underactive, adductor complex. Overactive on the right side is going to be adductor complex, TFL, and underactive glute medius. Again, exactly what we talk about every day in anatomy and with tech and everything. So this one is really, if you can help somebody in this too, this will give you a lot of work too, because a lot of people don't understand when it comes to like working on piriformis and how it can pull and different, and you know, when it comes to the left side being overactive, why, you know, does it pull to the right, blah blah blah, or whatever. So
Right, sorry.
no, it's all good. All right, so this is the cool thing. Actually, I'm gonna skip that one, and I'll come back to that. Okay, so we create a chart, and we basically say, okay, here's what's going on with you. You have a pronation disorder syndrome. Guess what the book gives you? All the stuff to do. Okay? A few things you can go in and add in yourself, but this is directly out of the NASM book. Okay? You can question if you want. Some of them I do question. But like if you know, if something that you got to inhibit, so basically you'll foam roll the gastroc. I don't ever do one set. I do for 30 seconds. I do about 3 sets of that. Of course, foam roll, TFL, IT band, lengthen, real simple. So static stretching of, you know, gastroc, soleus, tells you how long to do it, coaching tips, stuff like that. Activate. Okay, this is where you go in and start to really. This is where these two are where corrective exercises I think really come in to play. Is understanding activation and integration. And then, you know, of course, coaching tips, you know. So how can we make things better? Because honestly, guys, my idea is to never regress. But regression is a part of progression as well. So sometimes with people, you have to regress them. Maybe they can't hold for 30 seconds. They only can do it for 15 or whatever. So you can regress. It's okay. But you don't want to let them regress for like months, and months turn into 6 months, and then you don't see them again. So, but this is one thing I love about the corrective exercise book, is it really kind of gives you. There's another one, perfect example, like elbow injury or somebody like, you know, with basketball or stuff like that. Again, it gives you the corrective exercise strategy for preventing elbow injuries. So, you guys have seen all this before: inhibit, lengthen, activate, sets, reps, tempo, 4-2-2. You guys know what tempo is? Where you like go down for 4, hold for 2, and then go up for 2, okay? So eccentric, concentric, and then of course resting for 60 seconds. So again, another really good plus to me with, it's a no-brainer on some of this stuff too. But again, you still have to know your anatomy, physiology. You got to know your biomechanics and your insertions and origins. That's another thing that the CES book does too, is it really helps you push more the attachments into your, I guess, plethora of knowledge that we already get from here. Okay, so let me go back here now. So, check this out. I love this. Okay, anterior, lateral, and posterior. You guys will all get a copy of this. So, the foot turns out, wow, possible overactive muscle, maybe the soleus, maybe the lateral gastroc, maybe the bicep fem, and the tensor fasciae latae. I look at my knowledge and go, man, that's pretty solid. That's right on point in my eyes. I would add a few more things in there that we learned from here, but that's pretty basic. I mean, you know, huh?
It's like literally goes off what we're doing.
Exactly. So, and then you have an underactive muscle. Okay, well, guess what, guys? If it's lateral overactive, it's probably medial gastroc, medial hamstring, glute medius and max, gracilis and popliteus. And an example of exercise SMR, which is self-myofascial relief and static. So I would give them a calf stretch, I would give them a hamstring stretch, and I would give them a standing tensor fasciae latae stretch. And then shortening or strengthening exercise, a single leg balance reach or something along those lines. But in the NASM book, there's 150 exercises. So, I mean, for anything that's going on here, there's so many to choose from. They'll give you 10 of those, you know, for standing leg balance, they'll give you like 9 more options to do. And then in the lateral compartment, okay, so lumbopelvic hip complex, okay, most importantly, excessive forward lean. I'm just going to say the arms falling forward. That's very common, okay? So the upper body, the arms fall forward. Again, overactive. Well, the lats and the pecs and the teres major and the coracobrachialis. Kind of makes sense why it would be overactive, right? Underactive muscles, okay? Mid and lower traps, rhomboids, rotator cuff, and posterior delts. So you see, I mean, it's super easy to what we do. It's another piece of information I think that's going to help you in your field of NST. And then I'm not going to beat this whole thing up because I'll give you one of these to take home. They're also, you can find them on their website for free. You don't have to be a member. You can just go ahead and download it. And we went through that. And so here's the final slide before we get into this. So basically how CES and NST complement each other. This is the definition pretty much of CES, okay? So it's meant to remedy the cumulative result of stress placed on the body, helping to restore and maintain proper balance, mobility, stability, which allows the body to move freely without pain. What are we in the school for, guys? To do just that, right? And then the NST, so combining muscular manipulation massage therapy with science body alignment. Neuro-NST identifies the root cause, many pain syndromes, restoring balance, and alleviating pain and symptoms, stuff like that. So that's actually, I like these, and this is why, again, I'm going back, why I picked this school, because I was, for 10 years, I've been in kinesiology and in personal training, and this allowed me to step my game out of a gym. Nothing against the gym, because I think Tommy's on the right idea, where if he brings this into his gym, it's going to bring another clientele of not only helping but healing people within the gym. But I think, Tom, you already certified in this, right?
Yeah.
Yeah, so that's pretty much it on the slides, okay? So what I want to do next is, if you haven't got, you guys teamed up? Who hasn't teamed up with anybody yet? You, I think Alex? Okay, you guys are good? Okay, all right.
You've been assigned already?
I'll probably have this done by 1. So if you want to hang out, you have a partner? And Macy? I think for maybe 5 minutes? Yeah. All right, so.
Really?
Yeah. Perfect.
So I do need a volunteer. Tom, would you volunteer with me? Okay, so.
Oh.
On this chart, guys, we are going to go over it's real simple. So everybody look at the chart real quick. And so, of course, got to know your name. That's the most important. Okay, so, or their name. Okay, so basically on here, it's really simple. When we look at the anterior view, all we're gonna do is check a box. Okay, did their feet turn out? Was it left? Was it right? Was it both? Check both. Did the knees move inward? Did the knees move outward? You just put a check in the box, really simple. And we're gonna go from the left side to the right side. You're gonna have them turn around, and I'm gonna demonstrate exactly how to do this. You'll have them turn sideways, and then you're gonna look at the lateral view. The lumbopelvic hip complex you're gonna look at. You're gonna look for an excessive forward lean. You're going to look for a lower back arch, and you're going to look for a lower back round, and you're going to look for the arms falling forward. Those 4 things in the lateral view. You're going to go over one more to the right, the posterior view. Does the heels, don't get old, guys. Do the heels of the foot rise, left or right? Do the feet flatten, left or right? And is there an asymmetrical weight shift? Okay. I'm going to try to get to the modifications because I think they're important. Because a lot of times, but as far as the single leg, we're not going to do that part. That's a whole other entity. So, what I'm going to have you do, Tom.
I'll do this without shoes so you guys can see better too.
So basically, you're going to have people take their shoes off, okay? So what you're going to do is,
You have them take shoes off with the leg line?
if they have a leg length inequality, you can do both. I would start with the shoe on for a short leg. If not, I would take it off. So
I mean, you could probably put their lift on and still have like.
Yeah, I bought a lift
they
kit.
go barefoot.
I bought a lift kit for that reason. Okay. So again, what we're gonna line up. So with you, I would go in. I would already have a chart. So basically, I'm just gonna line you up a little bit further apart. Is that your template?
Mine's pretty narrow.
Yeah.
I mean, I would squat like 3 times my template, honestly, but
okay.
Whatever you want to do.
All right, so the idea, guys, is I'm going to show you from different views, but what the overactive overhead squat assessment is arms overhead, feet shoulders width apart, okay? Now I want you guys to look this way because I want you to see my arms, how they block my ears, okay? You see, it's hard to show you guys, but they're supposed to block my ears, okay? So when I go down into the squat, basically, I'm gonna go down just to chair level and come back up, okay? Now they're supposed to remain upright, okay? What happens is you're gonna see a lot of the distortions that I'm gonna show you, okay? But what I wanna do is I wanna make sure that if I ask them to put their arms overhead and they cannot even do that, then check that box already. You can still have them hold their hands up, but check the box. A lot of times what you'll do is you'll end up putting their hands on their hip for the modified, because that takes core brachialis out of it, that takes lats out of it, that takes pecs out of it. So you'll already know right away that those muscles are, you know, overactive in a sense. So you can check the box. So arms overhead, okay, and then, all right. Now I'm gonna look from the front. I take the chart. Anybody got a pen? All right, so you guys watch with me. Feet a little closer together. There you go, perfect.
Like that.
Yep. Okay, so now I'm going to tell you, just go down to about chair level and go back up. I want you to do 5 squats, okay? And you guys just watch. Okay, go back up. Good. And I'm just watching the foot and ankle complex. Do it again a couple more times. Okay. And one more. All right, good. And come back up. Okay, so you would mark if you saw, he actually had a pretty good squat. I saw a little bit of the kind of the feet kind of going a little bit of into supination. So I probably would say feet really didn't turn out, knees didn't move inward or outward in a sense. But if they did, you would just check that. Real simple, okay? The next one, now we're already done with the foot and ankle complex here and then the knee complex, okay? So I'm gonna have you same shoulders width apart. I want you to turn this way, okay? Now, arms overhead. Now remember from this side, now we're looking for the 4 items here, guys, are going to be, okay, this is what we're looking for in this view, okay? So what I want you to do is,
Is that the right plane there?
yep, so is as far as your arms can go up? Okay, so you see how his ears are blocked? Okay, that's what you want to look for. If he cannot do that, then you can just either leave him where he is at and just check the box that arms are falling forward. Okay, so I want you to squat down.
My pecs are really tight.
It's okay. Just do normal. I don't try to fight it. Come back up. Okay. All right. All right. And go back up. One more. You guys see this though?
Yeah.
All right, come back up. All right. Now I'm going to show you something. Arms overhead again. Now I want you to just squat and then just kind of stay there for a second. All right. Give me a good one. Okay. Stop right there. You guys see it? There's no crossing. What happens is over time is exactly, so that will do this. And once these cross, we actually know. So tibia, torso, they always have to remain that way. They can be a little bit deviated, but in actuality, that's going to let you know that there is a weakness again in the ones we mentioned, so the lats. Anything that can make the arm come forward, or there's an overactive. So I would check, again, I would check any of those. So yes, okay? And then final one, face the wall, okay? This is where it gets tricky. So I either make sure to have him tuck the shirt in, so just tuck your shirt in there. Because what I really want, you kind of have to look at the whole glute area, okay? Shoulders width apart, okay? Arms overhead, okay? And this one, guys, we're looking for, just to give you a heads up there. All right, so now we're looking for feet flatten, okay? Heels rise off the floor and asymmetrical weight shift. All right, you ready? Give me about 4 of those, okay? 1, 2, and give me 1 more. Anybody see asymmetrical in that one?
Let's go what?
To the left, I saw a little bit to the left. Other than that, I don't think the feet flattened that well, and the heels didn't rise off the floor. Okay, so but let's say they did. Okay, so awesome. Thank you so much. I'm just gonna check. Okay, your feet, your knees moved inwards here. I'm just gonna say you had an excessive forward lean, and I'm gonna say you had an asymmetrical weight shift to the left. Okay, what I'm gonna do now, and everyone's gonna get one of these. So just here, pass them around, would you mind? So again, I go to my handy dandy chart, you know, and I go, all right, well, the knees fall forward, and I just showed you guys up there. You just kind of go to the chart and be like, okay, well, in the anterior view, left and right knee moved inward. So again, what do I do? And so this will create the muscles that you have to work on, and the ones that are active and the ones that are underactive. And then of course you just follow this. But as the neurosomatic therapist that you guys are going to be here in the future, that really will kind of give you an idea of what to kind of work on, and then you add in what you need to add in. So I want you guys just to take a second, if you can, and just work on each other real fast, just spread out real fast. We'll spend about 10 minutes on this and then we'll be done, just to get an idea of what I was looking for. All right, so just break up into your groups real quick and I'll come around and answer anything.